idle hands are the devil's hands. I keep trying packing my days with work. I pick up jobs here and there and stuff like that. So it's really just maintaining my schedule, making sure that I don't have time to lay back and, start thinking about things like that. Keeping my eye on the future and forward.
What about meetings? Do you do AA meetings at all?
Yes. Right now I'm an outpatient with St. Christopher's via telehealth. I'm attending those twice a week as well as an individual meeting with my counselor. That's been a majority of the help that I've been utilizing since I've gotten out, outside of all the mental health through, professionals and such. But I've also sporadically been trying to attend AA meetings online as well as in person.
That'd be a good idea. I was biking up through north of here today, and I happened to stumble on a beach meeting in Venice, California. That's where I am. I'm in California. It was amazing. I was just driving by and I was biking by and I heard someone speaking through a microphone, and there was a big circle of people. It looked like it had to be 150 people out there on the beach. And I passed by and I went, wait a minute, that looks awfully familiar. And I turned around and went back and kind of carried my bike out onto the beach. And it was in fact an AA meeting. And, the beach meetings are always a little bit dicey because you can't hear anything, but these guys had a microphone. So it was pretty cool. And you never know what you're going to find. You never know what you're going to learn at one of these things. I think it's a good idea. The reason that we do this and the reason that we do groups at Midtown Health is because a lot of people don't go to those meetings, and we need people. We need our tribe. We need to be connected. And, often what I hear way down the road, and it could be a year in, it could be 25 years in, people say they stopped going to meetings, they stopped connecting with their sober network, and they go out, and sometimes they don't come back. So it's really important to start connecting with people outside of the rehab. I'm making this suggestion because it's important to build a network that's a lifetime, because at some point that one's going to go away, right? That's not forever. That's a finite amount of time. And at some point, then once that's gone, then you need, right? We all do. We need a sober network that we can rely on, which is why one of the reasons we do this, and one of the reasons everybody kind of connects outside of this group too, outside of our little group. Audrey's got her hand up. I see you.
Hands, because I never know when to interject. But Alex, if you feel comfortable, would you mind talking about how the drinking kind of progressed into getting so bad with the DUIs, and if you dealt with any mental health issues that made you want to drink, if you want to go into that?
Yeah. Initially it started off pretty hard because, I started right off with blacking out. And then I guess because I would smoke weed as well and do a bunch of other things as well. So it was a combination of kind of I'm young, I'm pushing my boundaries, I'm trying some new stuff. And the line between, young rebellion and actual, oncoming issues, my daily life started really getting thrown out of balance to the point where you just, this is something that's going to be an ongoing issue. And I found that out during the first DWI that I got. The short story is I was actually outside of a bar waiting for my brother to pick me up. And I went to go close up the windows to get my backpack out of the car. And because of that, the key was in the ignition, and the officer sits outside of bars to make sure that no one's driving. And he saw the lights turn on, and he gave me a pretty hard time after that. And I got charged for a DWI. That's just, it seems silly being okay, just don't give me such a hard time. Come on. But I'm so fortunate that it wasn't because there was no guarantee that wasn't the time that I wasn't just going to hop in the car and drive home anyways. But I didn't have my brother on the ride home because I've done that so many times beforehand. And so he stopped me, and that's kind of was the first progression. The second one was much, much worse. And I actually was headed home from work. I had stopped by the liquor store and I picked up some drinks. And then the next thing I remember is coming to and My airbag had been deployed and my car steering wheel was jiggling. And I pulled over, not knowing what had happened. And then the police had pulled in behind me and proceeded to arrest me. But that was terrifying. I have no clue what had happened, what the damage was, what I had hit. Anything between the liquor store and coming to pull over is lost to me. That was the moment I realized that, serious inpatient care was needed for me. And that was a huge progression and a sign for me. So thanks for the question.
Yeah, thank you.
Thanks for sharing that.
Do you mind if I interject and ask something?
Go for it.
So first of all, thank you for sharing your story and congratulations on 10 months. I know before you mentioned feeling, and I think this week you said you were feeling frustrated. I don't know if that's the exact word you used. So I just wanted to ask, what are you doing for self-care? I know you said you're doing things to keep yourself busy, but what are you to make sure you take care of yourself?
So you're right. I work a lot and everything, but where's there the time for me? My outlets are music, piano, and things like that. Being kind of so I'll be at home. I live with my parents, and a lot of time it's, even if I'm in my room, it's Alex, what's going on? You don't have a second to drop the shoulders. And I'm just it's been this past week, but playing the piano, getting out of the house, spending time with the dog that I'm raising, things like that. And not a big guy on working out, although I really should be working out more, but I'm always for outdoor exercise and everything like that. So yeah, that's kind of the regimen for myself.
Yeah. I mean, I definitely connected with when you said that. There's been lots of times in my sobriety where I felt super just frustrated and which could be easily abused, and that self-care was really important. So make sure, taking the time to get out with your dog and, playing music. I haven't worked out since before the pandemic. Yeah, it's all right. No shame. But I just wanted to make sure you're taking care of yourself. It's really important in our recovery.
Thank you.